for joining us for the Behavioral Health Confidentiality Toolkit webinar. We're going to go ahead and get started as it is 10 a.m. We're going to start with some brief housekeeping. We have over 200 participants registered for the webinar this morning. So as we have such a high level of interest in this topic, we're going to keep the lines muted just to ensure that there's no background noises this morning. We hope to have time at the end for questions, and we'll ask you to please type your questions into the chat box, and we will respond as time allows at the end of the webinar. And you may also email your questions or comments directly to Jackie or Kristen. We also have our emails open this morning to monitor for any technical difficulties that are going on, and we can try to respond to questions that we receive by email at the end of the webinar as well. We'll also be allowing for questions and comments to be submitted to us, that's Jackie and Kristen, until July 19th. We'll talk a little bit more about that at the end of the webinar. And also, so you know, this webinar is being recorded, and we will make the recording available after the completion of the webinar today. So to go ahead and get started, I'm going to introduce the presenters. This is Jackie Fabric. I'm a Behavioral Health Policy Analyst with the Health Systems Division. And then I also have with me Kristen Bork, who's a Lead Policy Analyst with Oregon's Office of Health Information Technology. One second, I'm having a little difficulty forwarding the slides. There we go. Okay, sorry about that. So I wanted to start with some background information on the Confidentiality Toolkit. The Oregon Health Authority created an internal behavioral health information sharing advisory group in 2015. The advisory group's aim was to help improve coordination between physical health and behavioral health providers. The group focused on developing a strategy to support integrated care and services by enabling electronic sharing of behavioral health information between providers. So the Confidentiality Toolkit for Providers that we're going to share with you today is an outcome of the work of the Behavioral Health Information Sharing Advisory Group. So this toolkit was designed with a few specific things in mind. It was designed to support integrated care, to provide an overview of confidentiality issues and the perceived obstacles to information sharing. And we say perceived as in many cases it's a matter of misunderstandings of when to apply the law and regulations. And in the ever-evolving world of healthcare and with the increasing ability to coordinate care and share health information, it's important to understand these laws. The toolkit is also designed to provide links to additional information which will be monitored and kept up to date and current as more information becomes available on some of these laws and regulations. We'd like to be very clear about what the toolkit does not do. The toolkit does not offer legal advice, nor does it take the place of your own legal counsel. So there are some specific reasons that the advisory group recommended the development of a toolkit. So as Oregon continues to work to integrate the delivery of behavioral and physical health, we want to focus on looking at the importance of sharing health information between providers to make sure that care is well coordinated for the patient. It is also becoming increasingly important to understand the legal barriers and common misconceptions of sharing behavioral health information. And additionally, federal and state health information privacy laws create a complex network of requirements regarding the use and disclosure of information. So we'd like to spend the rest of our time today walking through the toolkit. This is currently in draft form while we are in the stakeholder engagement period. And I'm going to hand it over to Kristen to walk through the toolkit.
Okay, great. Thank you, Jackie. And so as we sent out in the email update as well, there should be two handouts that you can access if you go to the sidebar of the webinar page. If you don't see the handouts or if you have any issues opening those, please go ahead and email either myself or Jackie, and we can send those to you directly, but you should be able to open those. So the draft toolkit is broken into sections, as you can see in the table of contents. There's an introduction, a summary of federal and state laws and regulations, frequently asked questions. These originally came from a series of webinars that we held at the beginning of the process, where we were talking about 42 CFR Part 2 and HIPAA. They have been updated recently with some of the changes that have happened in the regulatory environment. So they won't, if you had seen the previous version of FAQs, these won't look exactly like that, but they do address a lot of the questions that we have received to date in regards to privacy and security and information sharing. There are also examples of allowable sharing and links to some examples. There are sample common consent forms and instructions, a sample qualified service organization agreement, and sample qualified service organization language, and then other resources and some endnotes. And now we're going to spend some time walking through each of these sections. So starting on page 5 is a matrix of selected federal and state laws and regulations that are addressing confidentiality. This section identifies the law or regulation, provides a citation, a general description, the applicability, so for example, which entities this applies to, the information covered, such as protected health information, patient records, authorization forms, etc. So laws and regulations that are included are 42 CFR Part 2, HIPAA, ORS, HR 6, which is the Support for Patients and Communities Act, which is recent federal legislation for opioid use disorder prevention, treatment, and recovery. And so this section goes on for a couple of pages, and so you'll see these summaries listed. So the next section that we have is our frequently asked questions section. And the questions for the FAQs have been subdivided into sections such as general privacy law questions, 42 CFR Part 2 questions, HIPAA, Oregon law questions, health information technology, exemptions and exceptions to Part 2 regulations, and then consents and qualified service organization agreements. So the next section is examples of allowable sharing. And so these examples consider elements of analysis such as the information type to be disclosed, disclosing party, the recipient of the information, the purpose of the information sharing, and if the disclosure and redisclosure are permitted. This also provides links to ORS and 42 CFR Part 2, as well as a legal use case matrix that was developed by Reliance eHealth Collaborative. And again, you'll notice that a lot of these allowable sharing examples are links to other pages. So these are pages that are with other organizations. The reason why we provided links rather than copying and pasting is that this toolkit itself is a living document. We all know that the environment changes, and so we want to make sure that we can keep up with the changes, and also as changes are made to others' websites and others' information, it seemed better to link directly to their pages rather than to try to keep up with cutting and pasting into our document. So if you're wondering why that is, it's because we envision that things will keep evolving in this environment. So if we go to the sample allowable consent form, this includes instructions, and we're definitely very interested in feedback from folks, especially from consumers and family members, on whether this form is easy to use and easy to understand. We will, as we've said before, you can send emails to either of us to provide input, and we also have the chat box. As you have questions and as you have comments, you can feel free to enter those into the chat box as well. We may not be able to directly address them during the webinar, but we'll take everything into account as we're making edits and updating. So the next section is the Sample Qualified Service Organization Agreement. And this section outlines how providers can use qualified service organization agreements to allow appropriate behavioral health information sharing. And this includes substance use disorder treatment information between a Part 2 provider and a qualified service organization. And in addition to the sample language, this section includes a description of a qualified service organization and information on communications between a Part 2 program and a qualified service organization. Okay. So then we have the additional resources and links section. And so this includes links to SAMHSA guidance, to the Federal Register, including the electronic code, the Oregon Department of Justice Confidentiality Code, and information on HR 6, and then the Oregon Department of Justice guidance. And as I've said, we're going to make sure that the electronic version has the current links and additional resource links as they become available. We do have someone who will be having responsibility for the toolkit and ensuring that these links are kept up to date. And as a question for folks, I just received a message that the webinar seems to be stuck on the front page. Are other folks having that issue? In terms of not being able to see updated slides as we're talking? If you are having that issue, please send a chat to the chat box or send me another email. I just want to check and see if this has been an issue for everyone. Okay, great. We've so it might just be a few folks who are having this. We will be sending out, you should be able to download the handouts from the webinar. If for some reason you're not able to, please send an email to Jackie or myself, and we'll make sure that you get a copy of the slides in the toolkit in case there's something wonky happening with the webinar for you. Okay, so the Toolkit Timeline. So we have been gathering stakeholder input, and our timeline for that has been from May through July of this year. So as Jackie said at the beginning of the conversation, we would like to have any input from you all by July 19th so that we can start to incorporate it into the next version of the toolkit. We'll be working on revisions in August and September. And then we anticipate publishing the toolkit online in fall of 2019. We want to make sure that the toolkit is as useful for folks as possible, and that the language provided is as clear as possible. And so we're trying to be really careful with the revisions as well, just to make sure that it's really useful for folks. So that brings us through all of the slides that we have prepared for today. It was a high-level overview of what's available. So again, if folks have questions that they'd like us to try to address or comments that they'd like us to share, and you want to type those into the chat box, please feel free. And then also, if that doesn't work, please contact us via email with your edits, comments, and questions for the toolkit. It's really important to us to be able to have input from stakeholders and from folks who understand the environment really well. Because again, we want to make sure this is really useful for everyone.
So we're, going to pause for just a minute and see if any questions come into the chat or the email. right. We are not seeing any questions coming in, so we will go ahead and conclude the webinar for this morning. If you do have any questions, please email Jackie or Kristen and we will respond to you. And as Kristen mentioned, please send any comments, questions, concerns, edits, etc. to Jackie or Kristen by July 19th so that we can incorporate those into the revisions.
Actually, there are questions.
Oh, there are questions. Hold on one moment, and we're going to take a look at these questions. 1 second. Okay, so the first question is, does behavioral health only cover mental health services? Behavioral health includes mental health and substance use disorder services. And then what about housing? I don't think that we have specifically addressed housing in the toolkit. But we're going to make a note about that to look at that, and we'll check in with our housing specialists to see if that should be incorporated into the toolkit. The next question is, are we supposed to be utilizing the forms in this toolkit as opposed to our program forms?
The forms are not... they're meant to be a sample or an example of what could possibly be used or included in a consent form, but these are not mandatory forms. These are not forms that we're requiring folks to use. It's just if folks are having questions or having concerns about what to include in forms, these are some samples.
Next was the consent form drafted by OHA? We serve a low literacy level population, and I was wondering if we are able to modify it to accommodate to our population. So yes, the consent forms were drafted in collaboration with the Oregon Department of Justice, and that is actually something that we're very interested in, is looking at how these forms can be easily understood by all populations. And so we're really looking for feedback specifically on that. So as the question indicates, low literacy level, anything else. So as you're considering the population that you work with, or if you have consumers, or if you are a consumer or a family member, we're really interested in feedback on the form. Mm-hmm. If you could send us to it, that would be great. Another question is, could you please be more specific about what kind of data this covers? And I'm not sure that we understand that question, so if you could submit a little more information in terms of what you're wondering about in terms of what kind of data, that would be really helpful, and we can answer that. The next question is, does this include information about confidentiality regarding billing and insurance? Sorry, and my questions just moved on me really quickly, so I'm trying to find where I was again.
We didn't know, and that's actually, thank you for asking that question. That's a really good point to bring up. Because when we were looking at it, it was specifically, I don't think we don't have a section on that.
Yeah, we don't have a section on billing. So let me, that's a really good point. So Kristen and I are making a note of that.
Yeah, thank you.
Okay. Let's see, the next question is, will attendees get notified of when the toolkit is finalized?
Yes.
Yes, we can send out a notification to individuals that were registered for the webinar about when it was finalized.
And it will be posted to the website when it's finalized. So what you will likely receive is an email with a link to where the toolkit can be found.
Okay, the next question is, are SQSA agreements needed between organizations within the same CCO?
I think we would have to check on that.
Mm-hmm. Organizations within the same CCO.
Yeah, that question hasn't actually come up before, so we'll have to, thank you, we'll double check on that, and we'll add that as a question.
Okay. Okay, the next question is, as it relates to the specificity, of to whom on ROIs and the 2008 update of 42 CFR Part 2, common questions come up regarding what a valid ROI looks like between a Part 2 program and DHS, child welfare, and also ROI elements between Part 2 and parole and probation. Okay, hold on. I'm just making sure I'm seeing the full question here. So I'm not sure that we have the full question on this one. So if you could add a little more information about what exactly that question is. Is it just what a valid release of information would look like between those programs? That would be helpful to know. Another question came up about, will you be sending out the slides? I believe the slides already went out along with the toolkit.
They were, yes, those are both attached on the handout form, which you should be able to download. If you're having issues downloading it, or if you can't see it, go ahead and send an email to Kristen Bork, and I will make sure that you receive a copy of the toolkit and the slides.
Okay, the next question is there a reference to ORS 192567 in the toolkit? I believe that there is. And if not, we'll confirm that that's in there. And is there a reference to the Oregon Suicide Prevention Checklist for Providers published in 2013 by both OCCAP and OPPA? I do not believe that there is a reference to that, so we will pull that up and look into that and consider adding that reference. The next question is, can you send the questions and answers to us after the webinar?
The ones that are being sent in now? Yes,
Yes.
we can record those questions and the responses. We'll also plan on incorporating those to the extent that we can in the toolkit. But yes, we can post those as well.
Mm-hmm. The next question is, can the forms be signed electronically? So the forms that we have developed as part of the toolkit are not electronic forms. They're just a template, but they could be designed to be signed electronically by in partnership with someone's health IT.
Yeah.
Let's see. The next question is the ROI example you provide available in Spanish? We have not translated it to Spanish yet, but that is something that certainly could happen. We have a few languages that we generally do translate things to, so that could be translated to Spanish. The next question is, will you provide any additional trainings where you will drill down into some of the details? Qualified service organization agreements, for example. We do not have any additional webinars or trainings planned at this time, but there is quite a bit of detail about qualified service organization agreements in the toolkit that would be helpful to review and see if that answers the questions that you may have about those.
Right.
Next question, if you have an agreement with another agency, do you still need the patient to sign a consent form if it's for discharge planning or coordination of care?
Sorry, can you repeat that?
Mm-hmm. If you have an agreement with another agency, do you still need the patient to sign a consent form if it's for discharge planning or coordination of care?
I think we would need to check.
Yeah, I think that would depend on what types of organizations and what sort of agreements are in place.
Yeah. So we'll add that to the list.
Yep. Let's see. Going back on the first question someone posted, does this apply to health clinics that provide psychiatric services and prescribe antipsychotics, for example, with no psychotherapy? So again, I think that's really specific to the type of entity, and a lot of what the toolkit covers is the different regulations and laws so that you can review those to see if they do cover your organization. The next question is, we currently serve both mental health and SUD folks and are getting ROIs for our staff to talk to one another. I'm wondering if qualified service organization agreement would work to cover that instead of ROIs. I'm going to repeat the question one more time. We currently serve both mental health and SUD folks and are getting ROIs for our staff to talk to one another. I'm wondering if qualified service organization agreements would work to cover that instead of ROIs. So I think that's something that generally within an organization you don't need to have a release signed. So you might want to check with your own legal counsel.
Right. You may already have policies in place within your organization that could help to give some guidance for that. We can check and see, but that sounds like an internal organization question. But we'll write that question down and see if we can get any further guidance.
The next question is, are your forms applicable to children who are 14 and below? I believe they are, and we actually got a comment from another presentation on how to make that more clear and specific within the templates. So that is some of the information that we'll be taking back and reviewing. The next question is, hold on, I'm going to come back to that one because I'm having trouble understanding it. The next question is, on the authorization form, it does not specify what type of info to disclose: mental health, A&D, HIV, etc. My understanding is that 42 CFR Part 2 requires that the authorization specifies substance use records.
So we can double check, and then if necessary, we can add that to our sample.
The next question is, does a substance use disorder treatment ROI need to name a specific person, or is the name of an agency entity enough? So I'm going to repeat that one. Does an SUD treatment ROI need to name a specific person, or is the name of an agency entity enough?
We would have to check.
Yeah, I think that's very specific, and we would need to check on that, and I think it might depend on the agency or the entity that is signing it, if you're covered by 42 CFR Part 2.
Right. So So it sounds like, if I'm understanding the direction that the questions are going in, it sounds like there are some questions that folks are having where they're looking for more detailed guidance than what they're potentially seeing in the toolkit at this point. So I feel like we may have two types of questions and two types of comments. That we have questions that are directly about the toolkit and what's contained in the toolkit, and comments on what would be more useful. And then it sounds like we also have questions that folks have around details around information sharing, depending on specific nuances of different groups. So that's really helpful to know, that that we may have general information, but that there's a need, it sounds like, for more detailed information as well. So we'll make note of that too. So the questions that you're asking are really helpful for us as we're looking at how do we need to refine potentially the toolkit, or what are other additional areas of information that folks are really needing right now.
Okay, the next question is there a reason why there is an age limit? And
Which one?
It doesn't say anything beyond. Is there an age limit? So if you can specify which specific part you're referring to regarding an age limit, we can get back on that. It could be just dependent on a specific regulation that there's an age limit. Hold on. Actually, oh, I see. It's in the next question. Sorry about that. So the next question is regarding the age limit. Oregon Revised Statute 192398 provides disclosure exemptions for records of physical or mental health or psychiatric care or treatment of an individual who is less than 75 years old. Applies to any holder of public records. So that is specific to that statute. And we would have to look. We would have to go and look at that statute and see why that is specific to that statute. But that's an Oregon statute.
Yeah.
Okay. The next question is: does the toolkit address re-releasing of clinical documents received from other agencies or providers? No, it doesn't. And we will make a note of that and talk to Oregon DOJ about including something about that in there as well. Okay, so the next question is, does the tool provide guidance to providers on how to effectively have the conversation about privacy and PHI with patients and their families, supporters, especially in case of suicide or other self-harm and lethal means, and also reference to the 2015 legislative session? So no, it doesn't have information about those conversations. Those are usually dependent on whether you're a mandated reporter, which I'm imagining most people on this call are mandatory reporters. This toolkit does not include any guidance about having those conversations. It's much more specific to what the laws and the regulations are. The next question is, are you able to send out paper versions of the draft toolkit? No, we don't have the ability to send out paper copies.
No, we're only sending out digital copies, but if folks want to print it out in their offices for review to make it easier, that's fine.
Okay, the next couple of questions are about providing access to the Legal Action Center's hotline, so Oregon Health Authority does provide access to the Legal Action Center's hotline for SUD providers that are licensed or certified by the Health Systems Division. So if you are an entity that is licensed by the Health Systems Division and you're an SUD provider, you do have access to the Legal Action Center's hotline. And if you don't have the information on how to do that, you can contact me or Kristen and we'll get that information out to you. We don't have that available for all providers at this time. It's very specific who can access it, but if there are others that are interested, please let us know if that would be a useful tool and we can consider expanding that access. Let's see. So some of the questions we've already covered. Give me 1 minute to review and see where we are. So there's a comment that age specifics will be very important, i.e. guardians of under 14, under 18, adulthood. There is a difference between age of consent and release of information, and this is often confused for providers in their communication with and among youth and their parents. Thank you for that comment, and we will take this back to the Department of Justice and talk to them about adding some more specifics around those age specifics. Let's see. So the next question is, it seems like many of the FAQs have to do with Part 2 agencies, but most primary care clinics are not Part 2 agencies. Are you able to add more frequently asked questions specific to information sharing between primary care and specialty behavioral health providers? Yes, I think we can. And so if you could send us any of those specific questions, that would be really helpful, and we could expand that portion of the toolkit. For those of you on the webinar, if you have any specific questions that you are having regarding information sharing between primary care and specialty behavioral health providers, I think that was one of the intents of this toolkit, is that it would be very useful for continuing integration and collaboration and care coordination. So please send us any questions you may have so that we can expand that portion of the toolkit. Okay, I am checking. I think that is all of the questions we have. Oh, one more just came in. It might be a comment. Hold on one second. So this is around informed consent for integrated behavioral health providers, and that integrated behavioral health providers need to explain the relationship with healthcare providers in their clinic and the access to electronic health records for both primary care and behavioral health. Okay, so this is a comment about really looking at when information can be shared and not shared. So hopefully this toolkit will help to break down some of those silos and share the information so that we're able to integrate and coordinate care. Okay, I'm just looking to see if I missed any questions. We're going to go ahead and hold on for one more minute and see if more questions come through. Oh, okay. So a comment just came in that on page 26, the link does not produce examples for consents. So there could be a problem with that link.
So we'll double check that.
We will check that link and make sure that we get that corrected. Thank you for letting us know. Okay, I do not see any more questions coming in. So again, thank you all for your time today. You have our contact information. Please send us any questions, comments, etc., and we will work on getting the questions that we received today and the answers written up and sent out to those of you that were on the webinar. We really appreciate your time this morning and your great questions and comments.
And in terms of sending out the questions that we received today and the answers, you may experience a slight delay because we will be, there are some things that we definitely want to double check. And so we will be double checking our answers to make sure that they're completely accurate, that we've completely captured the question, and we'll probably be running some of them through some other folks as well. So if there is a delay, we are working on it. It's just that it won't be immediate like next week. It'll probably be in a couple weeks because we want to double check our answers and make sure. Okay?
All right. Thank you for your time this morning.
Thank you so much. We really appreciate everyone's interest and input, and we look forward to getting comments via email as well.